What's up, you guys? It's your boy Miguel giving you your daily dose of radiation. In today's video, we're going to cover the difference between X-ray tech clinicals versus nursing clinicals. So to give you some background and some credentials, I am X-ray tech. I'm board certified. Been in the game for 4 years, do night shift. And I know you're probably like, Miguel, what do you know about nursing? Well, my lady, the waifu, is a nurse. She's been in the game for like 6 years. So one time we just sat and talked and compared our education journey to compare how hard it was. And I'm going to just flat out put it, being a nurse is way more harder than going through X-ray tech clinicals. Like, we have our niche. Like, don't get me wrong, X-ray tech clinicals in certain areas could be hard, but like in an overall, it's harder to be a nurse, like go through their clinicals. So let me give you just the base rundown, okay? First of all, most of our instructors, like I'm an X-ray, most of our instructors don't go to the facility every day. It's like every semester they'll pick like a random day and they'll show up most of the time for like a part of the day, and they'll just look at you and be like, oh, are you in uniform? Okay. What are we doing today? Okay. Are you following your little college guidelines, which is like, are you wearing lead when you're doing this? Are you following, the basic protocol for the facility? And then like the standards of the college and all that. And they'll talk to some of your techs who are there and to your CI who runs the joint and type stuff. And then they may question you about some x-rays you've done. And that's probably about it. And then my lady, who's a nurse, she was telling me how their instructors, every single day they're at clinicals, one of their instructors is there. If they want to get a check off, the instructor has to be there because it's their license. And like for everything, if they want meds, it has to be like they have to go through a spiel to be able to, like, every little thing, it's with the instructor. Like to the point where my lady would have to go to their clinical site a day before to get like little info over their patient, memorize it, and then come back the next day if they want meds or what other check off they want to do. Like, it was a whole spiel. And I'm like, yeah, we don't do that. We just show up the day of and just roll the dice and hope you get it and hope you see some rare stuff like the skull or mandibles or sinus or whatever's considered rare in your area. Like, it's way different. And then like for ours, we have like a set amount of checkoffs that we have to get, and that's it. They not only have to get all these checkoffs, when you're at work, even here where I work, you're still having to check off on certain stuff, which just blew my mind because I was like, aren't y'all certified? Like, aren't y'all? It's like, yeah, but we still have to technically get said checkoffs and this. Like, it's very meticulous. So that alone it was just mind blowing to me that's how, which, I mean, it kind of makes sense because they're very like niche into the system because they do so much, and it's way harder being a nurse. Like our difficulty comes in when you're trying to get a check off and the bone is broken and the patient can't really cooperate, and you're like, I really need this, but it's broken and you can't move that good. And then especially if the tech who's trying to give you the check off is like very picky, it's like kind of those are the challenges you face as a tech, like as a student. Or certain techs are more like meaner to students. I don't know why. They don't like students. I've heard it all when I was a student versus, and even when I was a tech, and when I'm a tech right now, I hear people and I'm like, why are people so mean? They're like, oh, because they're mean to me when I went through the program and blah, blah, blah. They have their whole spiel, and I'm just like, okay, whatever. So I'm not like that because I'm not that many years of school. I try to be understanding and stuff. And then and then they have their like rotations of where they go. They have a little bit more because obviously they can like go to nursing homes. They can go like there's different parts of the hospital where nurses are at where we're not really at. Well, we are part of certain stuff, but it might be like cath lab, or like it would be like certain tech, like once you're a specific tech certified in a certain area, you'll be in said area where the nurses are. So like that's kind of different, which certain colleges do go through those, and you kind of get a glimpse at what those other techs do, which our college did, which is nice, give you a little insight of what, like if you like doing that. And then there, as far as like our rotations, they have completely different stuff. Like they like go overnight, like a complete, start at 8 or whatever, like 5 to 5, like overnight type stuff. They actually do that, and then start clinicals like way earlier. So it's interesting because like even right now, like I'll see them at certain times, and you can see certain students, and it will just be like, like our rotations have just been like the simple like 7 a.m. to like 3, 4 to 5 p.m. And then the trauma type rotation was like from 2 p.m. to like I think 11. It wasn't like true overnight stuff. So that's kind of different as far as the clinical stuff. And then theirs is like very, very, very strict as far as like their uniforms. Like even in school, like if they didn't have certain stuff, if they weren't in full, peak fit, they'd send you home, or they'll do a bunch of things. And ours is just like, well, you minus 10 points, like that'd be about it. So I can't say that it is way more harder going through their stuff compared to ours. I mean, each one has their own challenges, but I'll say, like, I'll give them that one, that it is more meticulous going through nursing. So, it's been your boy Miguel. See ya on the next one.